Okay, so hey everyone. We are the group presenting on Jackson County, Arkansas. So our group is myself, which I'm Lauren Appel, Bikram Gautam, Sarah Moore, and Courtney Rooks. And before we jump into our presentation, we do want to acknowledge the contributions by our colleague Bikram on this project. He actually took the initiative and started the presentation before we even met as a group and contributed significantly to this presentation. And unfortunately, he's no longer with us and passed away on June 21st. So we just wanted to quickly acknowledge him and thank him for his contributions to this project. Okay, so now we will be talking about the healthcare access and the policy that we're going to propose in Jackson County. So slide next. Okay, a little bit about Jackson County. It is in the Northeast Delta region of the state of Arkansas, which is outlined here by the star. The county was established November 5th, 1829, and is actually named after our president, Andrew Jackson. He was the first term president of the United States when the county was founded. Jackson County has rich Delta farmland, and the economy of the county is agricultural products mainly, which includes rice, soybeans, corn, milk, beef cattle, and catfish. Based on the 2020 census data, Jackson County has a population of approximately 16,755 and covers 642 square miles, giving it a population density of 26. For perspective, the population density of the state is 57.9. So we are safely referring to Jackson County as a rural area. Okay, next slide. So briefly, we wanted to touch on the population demographics of Jackson County. So nearly 80% of Jackson County is white. About 18% of the population is African American, and nearly 3.5% are Hispanic or Latinx origin. There are also small populations of American Indian, Asian, and non-Hispanic Pacific Islanders in the county. So for age and sex, out of a population of 16,755, about 50.2% are male and 49.8% are female, so pretty even split. People between the ages of 18 and 64 comprise more than half of the population, with the rest of the population either being under the age of 18 or 65 or older. And so for perspective, this is pretty similar to demographics within the entire state of Arkansas. Okay, so next slide. This slide shows Jackson County's health rankings in relation to the rest of the state. So these are 2022 county health rankings. So in health outcomes, which includes length of life and quality of life, Jackson was ranked 65 out of the 75 counties of Arkansas. So length of life is defined by the life expectancy and over the premature deaths. So it's also equivalent to the potential loss of life before age 75. And quality of life is self-reported status, which is the percent of low, and one quality of life measure that we're going to address is the percent of low birth weight newborns, which we will address later in the presentation. So as far as health factors go, Jackson County actually ranks worse, so 67th out of 75 countries. And health factors can include, not entirely, but it can include things like health behaviors like tobacco use, diet and exercise, alcohol and drug use, sexual activity, clinical care, which is access to care and the perceived quality of care that patients are receiving, socioeconomic factors, which can include education, employment and income, family and social support, and as well as community safety, and physical environment like air and water quality, housing, and access to public transportation. Next slide. So to elaborate on this further, we wanted to talk about health outcomes. So this is a map representing what we just spoke about. So you can see that the counties in dark blue have the highest rankings. So you can see that Northwest Arkansas, like Fayetteville and Pulaski, have high health rankings and better access to care. And then this is followed by light blue, light green, then peach, and the worst rankings being those counties that are shaded orange and then red. So this is referring to overall health outcomes, which again includes average length of life or years lost of potential life. And this also does include low birth weight rates. Okay, next slide. So this map shows the health factor rankings of counties, and the same color code applies, where dark blue is the highest rankings, followed by light blue, then light green, then peach, with the worst rankings being those counties shaded in orange and then red. And just a reminder again that health factors include health behaviors, clinical care, socioeconomic factors, and physical environment. So all of those factors play into the overall health ranking of a county. And we do want to point out that in this report, the 7 lowest ranked counties were, I hope I'm saying this right, Desha County, Chico County, Chico County, Phillips, St. Francis, and Jackson County is in the same bracket, which is red shaded as those other counties. Okay, the next slide. So this population health data is, that we thought, a very good representation of the overall health of the population of Jackson County. So you can see that the overall population health score is pretty poor at 23, but overall Jackson County fares better than both the state and national average when it comes to healthcare. Health insurance coverage, not healthcare, but health insurance coverage. So Jackson County has 9.4% uninsured people compared to the Arkansas average, which is 10.8%, and the national average, which is 11%. Employee insurance plans make up about 26% of the people who are insured. Medicaid makes up 33.2%. Medicare is 15.4%. Non-group plans are 14.5%, and VA or military insurance is 1.87% for the Jackson County. Where Jackson County fares worse is that they have a higher smoking rate as well, with 26.5% of the population who consider themselves smokers, compared to the national median of 20%. And they also have a lower life expectancy than both the state and national average. So the life expectancy of a person who lives in Jackson County is about 73.7 years. And this is compared to the national median of 77.5 years, about 4 years shorter. Okay, next slide. And then this is also a summary of the population health quality of life factors. So people who are in poor or fair health, poor physical health days, have poor mental health days, and have low birth weight. So compared to the rest of Arkansas and the country, Jackson has overall worse health outcomes. So Jackson County has a higher percent of adults in poor or fair general health, which is on the leftmost column. You can see compared to Arkansas in the middle column, and compared to the US in general on the far right column. Jackson County also has a higher rate of low birth weight infants, a lower life expectancy, and a much higher teen birth rate, which at more than 2.5 times the national average and almost twice the state average. Okay, so next slide, and my colleague Courtney is going to take over from here.
Thank you. I will be doing the access to care. Jackson County overall has better access to care than the state and the national average. As previously discussed, fewer people are uninsured. There is a higher rate of PCPs available in the Jackson County compared to the US average. As you see here, we have metrics to show the hospital bed availability, population with no healthcare insurance, as well as primary care doctor availability. As you see, the country has 0.0 for hospital bed availability. US is 1.9, peer group 1.7, and the state is 5.0. The population with no health insurance shows 9.4 for Jackson County, 11 for the state for the US. Peer groups is 13.2, and the state is 10.8. The primary care doctor availability is 1.2 for the county, 0.97, 0.81 for peer groups, and for the state is 1.22. Next slide. Here shows the primary care physicians by the counties per 10,000 population. They go within colors. As you see, the peach is 0 to 2.9. The green is 3 to 5.2. The darker shade green is 5.3 to 10.4. The turquoise is like a 10.5 to 17.2, as well as the dark is 17.3 to 33.6. The providers here in numbers of physicians per 1,000 residents for Jackson County is 3.0 to 5.2 per 10,000, below the recommended ratio of 2.4 per 1,000 people. This shortage of healthcare providers may result in a limited access to primary care services. There are 49 PCPs in the Jackson County, with 34 of those PCPs focusing on family medicine. There are 3 OBGYNs specializing, practicing throughout the Jackson County. Recruiting and retaining health professionals should be a priority to ensure adequate healthcare delivery. Next slide. Okay. Here, we're talking about the healthcare access with the hospitals. There are 2 hospitals in Jackson County, Arkansas, serving a population of 17,429 people in an area of 634 square miles. There is 1 hospital per 8,714 people and 1 hospital per 316 square miles. The 2 hospitals that are there is the Harris Hospital in Newport, as well as the Newport Hospital and Clinic that's also in Newport, but it is ran by Baptist. The Harris Hospital is operated by Unity Health. In Arkansas, Jackson County is ranked 65 of the 75 counties in hospitals per capita, and 18.75 countries in hospitals per square miles. As of now, the number of facilities may be sufficient to meet the healthcare needs of the county, but the distribution and accessibility of these facilities should be considered to ensure equitable access to healthcare services across all areas. Next slide. Clinics and medical homes. So here you see we have Unity Health, which has the Green Family Practice, Newport Primary Care, Newport OBGYN Clinic, as well as the Newport Surgical Center. They also have behavioral health services. They do some cosmetic services, as well as emergency medicine, family practice, general surgery, OBGYN, orthopedics, physical therapy, podiatry, as well as radiology. The River City Health, which has the Newport Family Clinic and the Newport Diagnostic Clinic, takes care of more of your cancer care, emergency room, your health care, mental health, orthopedics, outpatient therapy, radiology services, and surgical services. And the AR Newport is your primary care clinic. Next slide. Here we will talk about the health disparities. Jackson County has several risk factors for leading to healthcare disparities. Food insecurities is the amount of people who do not have access to reliable source of food during the past year, higher than the state average of 18.4. They also have child poverty. Those are children who are under the age of 18 who live below the federal poverty line, higher in the state average of 26.8% for the state, and our county is 43.9. The no transportation, households that do not have a means of transportation, is higher than the state average, which is 6.4. In our county, it is 8.1. As well as teen births in mothers aged 15 to 19 years old, a 5-year average, 59 births per 1,000 teenage females, higher than the state rate of 39.5. All of these issues can be combined and contributed to the problem access healthcare and maintaining good overall health, leading to inadequacies in care for this population. Next slide. So on this slide, it shows the disparities of households within poverty, which is 18.2% from last shown was in 2019, below the 100% FPL. The low income households, which is 45.7%, under the 200%, as well as social deprivation index, which is 80. And that also has to do with the living in poverty, under the age of 12, education, single parent household, living in rented homes, living in overcrowded housing, households without cars, as well as unemployed adults. Next slide. The maternal health care. Preterm births, Jackson County has a preterm birth rate of 12.9 compared to the national rate of 10.2 and the state rate of 12. Maternal mortality data is not available for the Jackson County alone. However, in the state of Arkansas in 2018, the rate of pregnancy-related deaths was 32.5%. Given that Jackson County has higher rates of preterm births, we can explore the trends in Arkansas to apply to Jackson County. Smoking during pregnancy is 11.6%. Tobacco use pregnancy risk assessment monitoring systems survey stated that the CDC part of the Safe Mother Initiative Arkansas has participated in since 1997 considered rates of smoking during pregnancy from 2017 to 2020. Those who quit most frequently did so on their own without the provider or the family support. Postpartum depression rates is between 2017 to 2020 have been stable with at 40% with symptoms of PPA and PPD. And this is where I will stop and hand this over to my colleague, Sarah.
Thank you, Courtney. So we're going to continue talking a little bit about some of the maternal child health and disparities, along with preterm births and some of the other maternal child health outcomes that Courtney was talking about. We also see a high rate of gestational diabetes of about 7%. This is pre-pregnancy and or gestational diabetes. Same thing with prenatal care. We see a high rate, almost 30% of women do not receive prenatal care in the first trimester. We've mentioned low birth weight rates. Our infant mortality rate in Jackson is also higher, 7.2 per 1,000 live births. We do have a high index of OBGYN providers per 100,000 population. So it's kind of surprising. We would think maybe a little bit better health outcomes for women and infants, but we're not seeing that in this particular county. We're actually statewide 50th in the nation in regards to women's health providers, but again, doing better in this particular county. And some additional disparities around maternal child health. The infant mortality rate for Black infants is 14.1, almost double what we are seeing in the white non-Hispanic population of 7.2. And then the ratio between these two groups is about 6.9. So significant striking disparities between Black and white non-Hispanic community members. As far as some trends, we're focusing on maternal child health because there is a heavy focus, I think, in the state right now. And we have pretty good data around preterm births, maybe not so much with our maternal mortality. There is more, people are looking more closely at it in the state, but we don't have really great data that goes back a ways, but we do have good data regarding preterm births. And as you can see, alike in the state and across the nation as a whole, we are actually getting worse. And I think a lot of people know that this has been in the news recently about how much we spend in healthcare and how much worse our health outcomes are, including our maternal child health outcomes. And so our proposed program to focus on the maternal child health outcomes and disparities is Healthy Start. It is a HRSA funded program that began in around 1991 with two primary aims: one, to improve the health outcomes before, during, and after pregnancy, and the other to reduce the racial and ethnic differences in rates of infant deaths and negative maternal health outcomes. Originally, Healthy Start was funded through 15 projects were funded as a Healthy Start program, but the program has been so successful in improving health and birth outcomes. There are now over 100 separate projects across the country. Healthy Start programs report on the same metrics as what we've discussed here: low birth weight, prenatal care. But one of the things that makes the program so successful is the awardees are able to tailor their programs to meet the needs of the community and their target populations. And as we saw rationale, just a quick review, we talked about the high rates of preterm births, teen births, low birth weights, and the fact that nearly 30% or 1/3 of women in Jackson County do not receive prenatal care in the first trimester. And so all of these things are tied into the performance measures of Healthy Start. And those are things that that program specifically targets. And so to be successful in implementing a Healthy Start program, one of the things we want to talk about is engaging the community, engaging the stakeholders, and to ensure the successful development and implementation of a maternal child health program in Jackson County. These are the steps we recommend. So first, conducting a community needs assessment and/or focus groups. Because we do have some community level data, it may be that we don't need to do something as in-depth as a needs assessment, but more of listening sessions, focus groups within the community to understand what the community sees as their biggest issues and health concerns, to make sure that whatever interventions that are being implemented are bought into by the community, making sure that their perspectives and insights are used to inform that intervention. We would also recommend having an advisory committee that consists of representatives from various stakeholders, including physicians, hospitals, nutritionists, community leaders, and members, and public health officials. The community advisory group would serve as a platform for open dialogue, collaboration, and decision-making throughout the development and implementation phases of the program. You'd also want to establish regular communication channels, such as meetings, workshops, town halls, online platforms, any way to facilitate ongoing discussions and information sharing among stakeholders. You'd want to have a variety of ways for that communication to happen to account for a rural community that may have limited access to online or digital platforms. You want to make sure that transparency is encouraged, active participation, and that respectful dialogue to make sure that stakeholders, people from different perspectives, the professionals to the community members, are all heard and able to learn from each other and share. You want to also, as we mentioned, engage the community members through focus groups, surveys, public forums to get their input. And when you involve the community members, as I mentioned earlier, it helps ensure buy-in, but also that your program is tailored to meet the needs of the community, and it's going to be much more successful. You want to make sure that you're working closely with physicians, healthcare providers, and hospitals in the county to ensure their active participation in the program, even if we would love for them to be represented on the advisory board, but if not, at least having those relationships so as interventions are designed and the program is implemented, they are aware of what's happening and can make appropriate referrals and help their clients, their patients navigate the program. And lastly, you want to make sure that you incorporate the expertise of relevant stakeholders and subject matter experts. So as we mentioned, not only hearing from the community members, but the experts who can help design a well-informed program to, again, ensure success. So in summary, we spoke about Jackson County, Arkansas. It is a rural Delta region county. It does have adequate healthcare access, actually higher than the state as an average, but they still have very high rates of maternal child health disparities, and that we would propose that implementing a maternal child health program such as Healthy Start would address some of these concerns or some of these health disparities by helping provide comprehensive prenatal care and education regarding healthy pregnancy practices and support expecting mothers. It also would align with the broader goals of public health, which prioritize improving population health and addressing health disparities. And with that collaboration between the local health providers and community organizations, you would be able to develop those crucial partnerships that would be successful in designing and implementing the program. Thank you very much for your time, and please don't hesitate to reach out with any questions. Thank you.
Thank you all.
Thank you.